available for your perusal at your leisure. So with that announcement, I'm going to start the recording. That's great. Thank you. So let's put the slides up, David. Let me see. Do I see myself? Do I see the slides? Or should I share my... Buenos dias. I see people putting in the chat their names. Fantastic. Thank you, David. So I think that we have all the logistics coming up together. Great. So it's 9:02. I think that we can get started. Happy New Year. Happy New 2021. Full of energy, full of all the good things that we carry from 2020. Let's focus on the positive and all the hope that lies ahead for new beginnings. Thank you so much for coming. Today, we are going to have some very good presentations and some updates of what we have been up to. Yes, please use the chat box to write your name, your contact information, and the kind of services that you work on or would like to share, any news announcements. We will have some time at the end of the call for those updates, but just in case, it's always good to put your email address there and links. So if any other of the attendees want to follow up right away, they can do so. So thank you much. With the slides, let me see, do I see the slide? Somebody's sharing their screen. Let's keep it with David so I can follow the slides. Well, David puts my slides back. It's funny how the live captions work with my accent. Very funny other words come up.
Brendaly, do you want to take over the screen?
Yeah, seems like that is the best choice. Share content. Can people see my slide set? Yes? Fantastic. Yes. So we begin. Oh, and that picture has some of the cards that many of you have sent to us to the Chula Vista Community Collaborative. So on behalf of my staff, thank you for those. It's always nice to receive some tokens of appreciation. Very nice. Thank you, Mike. So again, welcome back. We're going to give an update on some of our numbers and services and the work of the supporting our families over the holiday. We're preparing a short video. I sent that draft today to my staff, so I'm going to get feedback on that and then be able to share in a link with you. It's always nice to see the human factor behind the numbers and in all the families that we touch. That we were able to touch based on your donations and support. Also a reminder for our calendar dates and just a note to encourage you to fill out the partner survey once I send it later today. And of course, diving into the presentations from our partners and announcements. Our next meeting will be on February the 9th, so put that on your calendars. In terms of highlights, yes, when I arrived in July, we kind of closed that earlier chapter. We had put together already an annual highlights for the period before under the previous administration of Margarita Holguín. So you're welcome to go to the website and download that annual highlight summary. And since when I arrived in July till December, we underwent quite a transition, just like many of you, to moving more into virtual. And instead of thinking of it as a temporary measure, we really were integrating that into our day-to-day and really conceptualizing our events and activities in a way that, okay, we have to think out of the box. And our meetings became virtual, our work with clients, with appointments and servicing through windows at the FRC centers. Yet we were able to service 6,300 activities with our families, specifically in the area of Chula Vista within the pandemic. Those numbers in 6 months, with all the restrictions, all the learnings that we had to do on doing it in a different way, honoring those 4 pillars of protection for the staff and also security and safety foremost for our family. So it was a great ordeal. I really thank my staff. Just like with your organizations, all the adjustments we have to make, and kind of try to compensate or coming back, balance it up, the virtual world, given that we could not dive into activities that we'll share face-to-face. So more on that, you're gonna hear about those adjustments for 2021. The holiday season came right away in terms of honoring those commitments with Santa Shop, food distributions for Thanksgiving and holiday meals, and also those Adopt a Family events that we have been known for 7 or so years. And our hub navigators, the collaborative per se, and the 5 FRCs, we were able to continue our services and even expand a little bit with non-traditional holiday seasons items, but they were needed, like supplemental nutrition after operations, supplies like gauzes, masks, PPE, even roof tarps to help families in need during the holidays and stay warm and safe. So there's some, just a few pictures there. But definitely look out for the mini video that we will be putting together with some of these pictures and more. During Santa Shop specifically, I know we couldn't do that big, humongous event that some of you may remember. I wasn't here, but I've seen many pictures. But definitely we were able to do something with the staff help in taking more control of it. We divided it into 5 days during the week of December 14 to 18. And each center prepared, decorated, and had appointments back to back with all the sanitation procedures in place. But still, we were able to provide families across the 5 centers and their children. You see the numbers, and later on you will see more pictures. Here, a wonderful picture of one of the volunteers from one of our partners, the Chula Vista Welfare Council. So we thank them very, very much for their assistance and support. And here a list of everybody, and some of you may be joining us today. Thank you so much on behalf of the staff, the families. I'm reading still through the thank you letters of some of the family members that sent back to us, many of them in Spanish. So you will see that in the compilation later through the link, because it's really touching. And just as you guys have served in your families through the services, many individual donors came through as well, given that they were not able to maybe donate their time. They were able to donate gift cards so we can fill in the gaps on the needs of our families. And even children, they were happy bringing in their own toys and toys that they have personally selected to share with other kids. So that was very, very uplifting to see. And hopefully we'll continue that tradition in 2021. A reminder of our calendar dates. We have our incoming collaborative meeting partners dates. Take a look at that, and if you're interested in giving a short presentation, 15 minutes, just like our partners are gonna do today, please let me know on your date, and we can take it from there. We can provide some guidelines in terms of how the length, and maybe we can brainstorm ideas about making it interactive with the audience. So looking forward for those presentations the rest of the year. In that, and it's a moment of reflection in terms of not only what happened in 2020 and what we're carrying, how we are facing 2021, but I wanted to with that survey, and this is how I'm going to frame it for you all. So when you receive it, it makes sense. I do want to think about how to highlight the value of our partnerships. Focus on opportunities, funding and non-funding partnerships within the human and social services ecosystem. I do want to define and more clearly and communicate kind of the value proposition of you belonging to the collaborative and us being together, because that's the selling point, right? That's that's the glue that brings us together with that holistic value of partnerships with given infrastructure, and so we can put proposals together for more program funding and maybe tap into diverse sources of funding that we haven't thought before. That kind of engagement that comes with new blood, new energy, and looking into sustainability. So that is something that is kind of couching my thoughts regarding that survey, and an opportunity for you to share your ideas and your thoughts. And I will do a summary of that, a context for you as well in the survey. We are going to share some updates too, based on the work on those 6 months with my staff. There has been some ideas percolating, and we want to share with you all today. Maybe some of your organizations or partners or somebody that you know of would like to connect with us after the call via email or phone regarding those topics. And that's why I'm going to have a staff member also join me, Azucena, for some of these. So with adultos cibernéticos, for those of you, it's from English speakers, loose translation will be like cyber older adults in the cyber world, because we have been finding that servicing our families does need to include the older Latino Hispanics. They are now, we see more of those multi-generational families coming together and not only sharing space, but roles and duties within the family and taking care of each other. Now, many times we are confronted with the need, where there has been a digital gap with our older adults, not being able to maximize the use of their phone for communication, for service delivery, and now more and more for chronic disease management and telehealth. So we're really excited about the opportunity to touch the lives of these older Latino adults and bringing them into or helping in any way we can with the information superhighway and how to use these tools that they are at their hands. So I'm very excited about that. Remember that our funding really comes from the Chula Vista families, the elementary school district. So our primary focus is the children, but in servicing the children, we have to account and serve as well the adult members of the family unit. We have been already putting the building blocks for more capacity building within our staff and the promotores in particular, community health workers. And that is important because they are kind of a backbone of our service. Many of our staff members are called something else. They may be called navigators, they may be called the CRSs, community resource specialists, but bottom line, the role is of promotores. and with some specialized work attached to it as well. So we have been able to connect with other partners and being able to provide some scholarship for nutrition. And I see some of the recipients of those scholarship for nutrition certificates for our promotores. So I want to congratulate them for having applied and making that commitment for capacity development and professional development on their behalf. We have more, and I think Azucena has joined us. She can tell us more about the Mask Mondays.
Yeah, good morning, everybody. Yeah, CVCC will start making again like our Mask Mondays, and we're gonna have a free distribution of face masks here in the CVCC. Our address is 540 G Street in Chula Vista. And we are in front of, we're gonna be like distributing in front of the Vista Square Elementary School. Every Monday is starting January 25th from 1 to 2 p.m. So please, if you have any questions, you can, let me have my phone number, 619-427-2348. And please share this information. This is about Mask Mondays. And also, CVCC is planning to do Es difícil ser mujer, or in English, it's hard to be a woman workshop. But this is the first time that we're planning to do them virtual by Teams. More information to come. We're planning to start on February. Hopefully in February, it's gonna be a 6-week sessions, and we're gonna invite all the families of our districts. So we're gonna share all the information in a flyer and distribute it. And if you have any questions, you can contact us.
Yes, and Azucena will type in her email address and her phone number in the chat box so you can check. I know that it's going to be a transition from moving that workshop from face-to-face format into online delivery, but we will make that shift and be learning as we move along. The Mask Mondays, again, thank you the partners who have provided some of that PPE, and I'm in waiting for some hand sanitizers as well. As soon as those arrive, we'll be making those packages available for distribution in a safe way. We have found that those drive-through events are very convenient, and from the people do not have to leave their cars. They go through, and we are also protected. Our staff is protected as well, and it's a contactless event. We request the individuals lower their windows or open their trunk, and we provide our items. That's how we have been able to do a couple of those drive-throughs on school, back to school supplies, masks, food distributions, and the lot. So we're going to keep bringing that from 2020 to 2021. Also, the good news with our Hub Navigator program, we got continuation for that program for 1 more year. And that is a project that it started as a pilot last year, and this year we're going to, it is more robust. The team has been tightened, and we have been able to continue that, providing more specific a follow-up, expanding the role of the promotora more into a navigator role within health plans. And it's a nice team, a very dedicated staff under the leadership of Carlos Corona. So I take my hats off to that team. I see some of your members that have joined from that team, and we're very excited to share their successes. Now we begin with some of the updates from our partners. There are some full presentations, but just very quickly, we have one, I think, no, hold on. Yes, we donate blood and plasma. So now that more, unfortunately, more people have contracted COVID-19 and many have survived, you may have the opportunity now to contribute with donating plasma. I know maybe somebody from the blood bank is here to say quick words on that. They may join us later on, but you will receive this flyer with the materials and the files that are uploaded later today by David in our webpage, and you can get more information on that for distribution. We have more updates and presentations by partners. We have the San Diego Promotores Coalition. We have San Ysidro Health and San Diegans for Gun Violence. Let's begin. David, can you take it away with the presentations, or do I have to continue in control of the screen?
You can do that.
Well, if you have it, let's do that so I can check emails and texts that I have been receiving in the chat box. So I stop the sharing option, and then you take over?
Yes.
Our first, do we have Herminia Ledesma from the San Diego Promotores Coalition? I do see Lori Van Oden, so probably we can do Lori first, and then we'll check back with the other speakers for today.
Sounds good to me.
Hi, Lori. Good morning. Thank you for joining us and providing you with the presentation. We have the San Ysidro Health presentation as well. Hopefully, Alejandra Perez will join us in a bit. And in the meantime, we will do the San Diego for Gun Violence. I know, coming from Puerto Rico, I know gun violence is a big topic, especially during the holidays. People throwing and shooting kind of like in lieu of fireworks and things like that. So I was so glad to see that here is not such a tradition. So I'm glad to hear that, but still is a issue of concern. And thank you for your time, Lori, for joining us today and presenting. We start at 9:25, so you have 15 minutes, and hopefully there will be some questions from the audience at the end. Thank you.
Great, thank you so much. Hello, everybody. I'll start out by telling you a little bit about myself and how I got involved with San Diegans for Gun Violence Prevention. My name is Lori Van Orden. I was a kindergarten teacher for 20 years in the San Diego Unified School District. And during that time, I'm sure many of you will remember that one of the events that made the most lasting traumatic impact on me and so many others was the mass killing of students and school staff at Sandy Hook Elementary School in 2012. And that horrific event and the other school shootings that followed were always in the back of my mind every time I entered my classroom. Shortly after I retired, the Las Vegas mass murders took place, and I knew that I had to get involved to do what I could to prevent gun violence. So after 3 years of volunteering, I'm currently a board member of SD for GVP, the Education Committee co-chair, and also the San Diego lead for the Moms Demand Action educational program, Be Smart for Kids. And I'll talk about that in a few minutes. Next slide. So let's start with the statistics. Americans are 25 times more likely to be murdered with a gun than people in other developed countries. Next slide. Every day, 119 Americans die from gun violence. And I just had to update this for 2020 because sadly, this number has increased since last year. Next slide. Every month, 46 women are shot by their current or former intimate partner. And presence of a gun in the home makes it 5 times more likely domestic abuse will become lethal. Next slide. So every year, more than 40,000 Americans die from guns, and 60% of that number are suicides. Next slide. So since the coronavirus crisis began last year, we've seen a surge of gun purchases, many by first-time owners. According to the Trace, Americans bought an estimated 1.7 million guns in November of 2020, and that was a 52% increase from the previous November. Sales have topped 20 million for 2020, according to one estimate, far surpassing the previous record of almost 17 million in 2016. So this, combined with families under stress from illness, job loss, and the struggles of educating their kids from home, can make the threat of gun violence even more pressing. So next slide. So we have a gun problem. So San Diegans for Gun Violence Prevention, we're working together for change to prevent gun violence. Next slide. So here's where we can make a difference. So we can change the gun laws. With a new federal administration, we finally have the opportunity to get common sense gun violence prevention legislation passed, and polling shows that the majority of Americans support these measures. For example, requiring background checks on all gun sales, reinstating the ban on assault rifles, and requiring extreme risk protective orders. And I'll talk about those a little bit later as well. We also need to change the gun industry, which means ensuring that federal gun dealers follow the law. And we need to change our culture. We need to educate about the importance of safe storage, suicide prevention, and how individuals can make a difference. So next slide, please. So we respect the right of all law-abiding Americans to own firearms, but with these rights, there are also responsibilities, and it is a balance. So we need to balance the need to preserve public safety with the rights of responsible citizens to own and use guns through legislation, education, and outreach. Next slide. Also, as time has passed, our priorities and those of our parent organizations have expanded to address the impact of guns on suicide, urban gun violence, and domestic violence. So, I'm sorry, next slide. As a volunteer, as I spent more time on learning about gun violence prevention, I found out that while mass shootings have increased and make the headlines, the reality is that for children under the age of 13, gun homicides most frequently occur in the home. And one study showed that nearly 90% of unintentional shooting deaths and injuries among children under the age of 15 also occur in the home. So next slide. And when we talk about incidences of gunfire on school grounds, we know that 78% of shooters under the age of 18 obtain their gun or guns from their home or the homes of relatives or friends. And we also know the toll that suicide has taken. And having a gun accessible can turn an impulsive act into a fatal one. Most people who attempt suicide do not die unless they use a gun. In fact, 85% of suicide attempts with a gun result in death. And that's a much higher fatality rate than any other means of self-harm. And sadly, 40% of child suicides involve a gun. So next slide. So it became clear to me after learning more about this issue that safe storage of firearms is crucial to gun violence prevention. And awareness of safe storage isn't just for gun owners, because it's for all parents who have children who visit other homes. And in California, it's not just good safety practice, it's the law. Next slide. So in 2015, Moms Demand Action for Gun Sense in America launched the Be Smart campaign to raise awareness that responsible gun storage, storing guns locked, unloaded, and separate from ammunition can save children's lives. Be Smart emphasizes that it's always an adult responsibility to keep kids from accessing guns, and that every adult can play a role in keeping kids and communities safer. Next slide, please. So there are nearly 3,000 trained volunteers in the US who deliver the Be Smart message across the country. In addition, sorry about that, there are almost 17,000 people who volunteer to spread the word about Be Smart. Since the inception of the program in May of 2015, there have been over 6,500 events across all 50 states. Next slide, please. So the SMART in Be Smart stands for S, secure guns in homes and vehicles. M, model responsible behavior around guns. A, ask about the presence of guns in others' homes. And this is one of the most important points because asking about guns has not been typically part of a parent's conversation with another parent or a family member when they're talking about safety issues. Back in the day, personally, I would talk about my son's allergies, for example, but it never even occurred to me to ask about guns. So this can be awkward at first if you're not used to doing it. So when we do our presentations, we do try to do some role playing if there's time. So moving on to the R, that is for recognizing the role of guns in suicide. And T, we want you to tell others to be smart. Next slide. In normal times, our trained presenters show up in person to present a 20-minute program for parents. Here in San Diego County, we can deliver our information in English or Spanish, and the program is 100% free. In the past 2 years, we've been able to spread the Be Smart message at a number of PTA meetings, civic and faith-based organizations, and even to medical students at UCSD. We can also deliver our message virtually like I'm doing today. And we're hoping to do more of that in the future because we're committed to spreading the news of safe storage far and wide. Next slide. So this is critical because approximately 4.6 million US children live in a household with at least one loaded unlocked gun. And that number has undoubtedly grown with the explosion of gun sales in the last few months, many to first-time owners. You can check out the national website at besmartforkids.org, or you can contact us here in San Diego at besmartsd1@gmail.com. And I also have some flyers available that hopefully we can put the links in the chat and you can access those there, or you can get those off the regular website. So next slide. Another area that we're working on educating the public is about gun violence restraining orders. So are you afraid someone you know will do harm with a gun? In California in 2014, a law was passed to allow gun violence restraining orders called GVROs, or sometimes called ERPOs. And those can protect you and your loved ones. A GVRO is a civil court order that allows law enforcement to temporarily remove firearms and ammunition from a person at risk of suicide or harming others with a firearm. While the GVRO is in force, it prevents that person from possessing or purchasing firearms and ammunition. Family, household members, and law enforcement can initiate a GVRO. So here's how. If you're in immediate danger, you should call 911. Not in immediate danger, you should contact your local law enforcement. GVROs are not no contact orders. For more information, you can visit the website, and this is kind of a long one, but www.courts.ca.gov /1260.htm. So next slide. And the Speak for Safety website is another good source of more information if you are interested in learning more about gun violence restraining orders. So that's speakforsafety.org. Next slide. So we also promote other programs for change, and we have SD for GVP members and experts who can speak to your organizations on a number of different topics, including gun legislation, what you can do to help end the epidemic of gun violence, and gun violence as a public health crisis. Next slide. And our young people are leading the charge to reduce gun violence. In San Diego, Team Enough is a youth-led group who advocate and educate. Next slide. Got some pictures of different activities that they've done. And next slide. Also, Students Demand Action is another youth group, and we have several local groups in the San Diego area committed to ending gun violence. Next slide. In the before COVID times, our members could be found at many of San Diego's community gatherings, such as Earth Fair and Day of the Child in Chula Vista. Next slide. We participate in vigils to remember the victims of gun violence, and we did those in public, and then we've moved those online, but we're still going forward with those. Next slide. We partner with a variety of community organizations to reach out to neighbors and places heavily impacted by gun violence and to increase public awareness. And here are the logos of many of them. Next slide. We march and rally to support gun sense candidates and causes. Next slide. We are supporting gun sense leaders, and here are a few of them, past and present. Next slide. We collaborate with our local elected officials to introduce and support the passage of common sense gun legislation, like the City of San Diego Safe Storage Ordinance. Next slide. And what that says is that in the City of San Diego, this ordinance will require firearms in a residence to be stored in a locked container, locked with a trigger lock, or in the immediate possession of the authorized user. Next slide. So to sum it up, we are all about advocacy, legislation, and education, and always remembering that crucial balance. Next slide. And you can join us. We meet on the first Saturday of the month at 10 a.m. and right now it is on Zoom until further notice, which for some people makes it more convenient. And if you're interested, you can reach out at any of the links on this slide, or you can message me in the chat. And I thank you so much for listening. We appreciate being a part of this powerful collaborative. And last slide. So we are San Diegans for gun violence prevention. And also we have a flyer that we'll have a link to in the chat as well. So thank you so much.
Thank you, Lori. And I want to open the floor for any questions or clarifications that may arise. Maybe if not in the chat, you're welcome to raise your hand and ask a question. And when I say raise your hand, you can do it on the screen or with the function on top that next to it, where the camera is, and you can raise your hand.
And if people think of things after, I'm happy to answer, if people want to reach out, we're always happy to follow up too. So I know sometimes you have to think on it a bit. So.
Yes, certainly so. Thank you, Lori. Thank you, and you're always welcome here. While David prepares for our next presenter, Alejandra Perez on San Ysidro, let me double check. And do we have Micaela from the blood bank? Maybe you can tell us more on the blood drives.
Yes, absolutely. Hello, everyone. I'm Michaela. I was just reaching out specifically for convalescent plasma. I did do a presentation in the past that talked a little bit about it. What convalescent plasma is if people who have recovered from COVID-19, they have antibodies in their plasma that can be life-saving antibodies. We're currently the main provider of all Southern California. And as you guys are all aware, there's a lot of need. So we're really reaching out to the community. I can send this flyer. If you could pass it out to your members, that would be wonderful. We have recently opened we shifted our Chula Vista Center from the old Sears building, and now we're in Terra Nova Plaza off of the 805. So please come and see us. If you don't know if you have the antibodies with all of our blood donations, regular ones, we actually do antibody testing. So that can be your first step. Does anybody have any questions for me? Nope. Okay.
Yeah,
Well,
I just had a quick question. Mm-hmm. Do you have hours? If you can share the hours you're available at the Terra Nova Plaza?
Absolutely. I will share the hours in the chat, and then I'll actually do a flyer for you guys that has the Terra Nova information as well.
If I can be very greedy, and I'm sorry, my name's Angelica Maldonado. I'm the Parent Engagement Liaison with the Chula Vista Elementary School District. If you have it in Spanish, I will be even a bigger fan.
Oh, yep, we have both.
Of your organization, and perfect.
I'll put it in the chat, but also can you send me your email so I can send it directly to you as well?
Absolutely. Thank you so much.
Yep, thank you. And thank everyone else for getting the word out. There's a lot of things that we don't have control of, but this is something we can do to make positive change. So thank you all.
And the good thing on using this team platform is that all the messages in the chat they're there recorded, and you can come back at any time and take a look at those email addresses for follow-up. There was a question for Lori. Let me see if we can handle that right away. And the question is, what are the current licensing laws? Can you do a brief answer to that, Lori?
Well, if you're talking about gun licensing laws, I honestly, I have to be honest, I'm not an expert on that. I'm more know the storage legislation. If you wanted to find out about gun licensing in California, I'm sure you could look at california.gov, you know, and Google it and take a look at it, or you know, contact your local law enforcement and find out about that. But yes. I appreciate your interest. Thank you.
Yes, and definitely for more follow-ups, there even is a request here about presentations geared for students in middle school and high school. Is that a possibility?
Well, the Be Smart program is geared towards adults because parents have the ultimate responsibility for their child's safety. So we don't do that particular presentation for children. We could do it to their parents. As I said, we do have other groups, Team Enough, and we have Students Demand Action. And if there was a middle school group that wanted to, you know, have a talk, that might be a great way of doing it, because then they're hearing from, you know, maybe their older peers and talking about the, you know, the whole issue of gun violence prevention.
I'm glad to see that you, I mean, there's a big pie of topics and there are many angles, and you're specializing on one, but always can make a referral to other partner groups that you have liaisons with, and make honor one of those requests. Thank you for that, Lori.
You know what, and I'll put my personal email in the chat if anybody wants to reach out to me, and I'd be happy to, you know, help you with whatever you're interested in. So.
Yes, you already have a request for representations for parents in elementary as well. So you can communicate already with Angelica Maldonado at cvesd.org.
Okay, I'm writing that down right now. Thank you.
Yeah, everybody gets homework. I'm a former teacher, so I like homework. Okay, thank you, Lori. So moving on, I think also we have Jared from Safe Families for Children before our next presentation. Jared, are you there? While we set up the presentation, yes, you can give us a brief synopsis of who you are, what you do.
Yeah, hi everybody. My name is Jared Johnson. I'm with Safe Families for Children. I'm glad to be here for the first time. You guys got a really healthy group going on here. And Safe Families for Children provides short-term housing for families who are in crisis. So a lot of times our families might be homeless or need to do a drug inpatient program, or maybe they just need 2 or 3 days just because things are really escalated in their home. And so what Safe Families does is hosts the kids for those few days, short term, anywhere from 1 night to maximum of like three months. And so we currently have over 70 homes in San Diego that have been live scanned, background checked, trained, home studied, and are ready to like support families. So that's what Safe Families does. What we're mainly looking to do is one, grow potential referral people. So like you guys who have a pulse on families who might be in crisis, and then just get the word out that that those homes are available. So we'd love to answer any questions you have. I put my information on the chat. You guys can email or call me back.
Thank you, Jared. And
thank you.
Yes, of course. And just for those comments that I see on the chat, we're putting all these flyers in the package that is to be downloaded by you guys after David pulls them up this afternoon, along with all the slides. So we cannot, I mean, we have about 80 plus at some point members today, and I cannot personally send the email to each of you, but all of you can access all these flyers and slides in our Zip drive in our website. We have hopefully Herminia Ledesma from the San Diego Promotores Coalition. I know that you didn't send slides, but maybe you can give us some updates on the coalition and what you guys have been up to since December.
Yeah, thank you. I'm joined, and I was actually about to text you because I'm only able to stay until 10 a.m. So I was worried that I wouldn't make the announcement.
We're communicating.
Thank you. So hi everyone, my name is Herminia Ledesma, and I'm one of the co-chairs of the San Diego Promotores Coalition. I just have a quick, I have a few just updates from our part. First off, I wanted to thank all of you who supported this year's conference in December. The work that CVCC did to support the conference was crucial, and we definitely couldn't have done it without a few folks. I won't name all, but just know that CVCC was the backbone organization for the conference, so we all really appreciate that. And we appreciate continuing the strong collaboration with CVCC. A few other announcements from our part. Our next monthly meeting is on Wednesday, January 20th, from 12 to 2, I'm sorry, via Zoom. We hope that all of you can join our meeting. And I will send David this paragraph, and it does have some information on there. If you don't already receive our San Diego Promotores County Coalition emails, you can email sdpromotores@gmail.com to be added to our listserv, our distribution list. And then we can share all of the information regarding our meeting. If January is, January 20th is a little tight for you, we also typically have our annual in advance, which is our strategic planning meeting for the year. And typically we plan it in December for the year ahead, but this year, COVID has changed a lot of our timelines. And so we're being flexible, and our advance is February 21st. So if that's also just an invitation for you all to come share and shape what the work of the coalition can look like in 2021. And that is also in February. We haven't set a date yet, so the best thing would be for you to get connected to our Gmail. And then just two more announcements. In December, the coalition, some of the benefits of the coalition are that we do host events and scholarships for community health workers. In December, for the first time in a while, we offered 4 scholarships to the Diplomado en Nutrición offered by the Health Initiative of the Americas. And 3 out of the 4 awardees were from CVCC. Gabi Ruano, Azucena, and Aida were all selected. Congrats to you all. And I'm sure you already are busy with the work that comes with being part of a program. And so we can't wait to hear from you all, your experience, and also just the feedback, and obviously giving more tools for you all to share with our community. So we're very excited. Congrats to you all. And then lastly, just a reminder that the COVID vaccine is now being offered to CHWs. And as you know, this is really important. So if you don't have access through your employer, you can go to county sites and you can get the vaccine. Appointments are necessary. A lot of the appointment sites are, one of the larger ones is Petco Park. And again, all the information is on the website, and I'm sure Brendaly is already on top of it, but we'll share it again. So those are my updates. Thank you all for having me, and sounds like it's a very full meeting, so hopefully I didn't add too much to that.
No, thank you, Herminia. And the San Diego Promotores Coalition is always welcome to give announcements and updates and make invitations for their call schedule. So thank you for joining us today. And let me see, we have somebody else also, Jennifer Bauman. Jennifer, do we have you on board?
Yes, I'm here.
Okay. Let me very briefly show the slides that you had sent us with an announcement for January 14th, 2 days from now.
Yes. Thank you all, and thank you for allowing me to steal some of your time. I'll try to keep it short and sweet, but my name's Jennifer Bowman. I'm an investigative reporter. I work for an organization here in San Diego called iNewsSource. If you haven't heard of us, we are a small but mighty newsroom that is focused on investigative and accountability journalism. I'm happy to be here and to meet you all virtually. I was raised in Chula Vista and live in Chula Vista now. And so our event is kind of looking back now that we are nearing the 1-year mark of the COVID pandemic here. We have a discussion set up at 5:30 p.m. on Thursday. It's a free event available in English and Spanish. We'll be looking at the lessons learned so far, how folks can stay safe and where you can turn for help. We'll be providing financial resources, mental health resources, and also providing an opportunity for attendees to speak with our panelists. Our panelists, we have a really exciting conversation. You can look at the link there with some of the biographies, but it includes Mayor Salas and some others. So I'll add the link and my email address. If you have any questions about the event or even iNewsSource or are looking for a point of contact in the news media, feel free to give me a shout.
And Jennifer, I was ahead of you. I already put it in the chat, in the meeting chat, the information for January 14 with the Zoom event and links with your email address as well.
Perfect. Thank you so much.
Yes, and to Anna Simmons, I was checking on the emergency housing for family. Jared had already included his comments. Just scroll up, very up in the chat box, and you'll find it, Anna, okay? Now, I think that Alejandra Perez is still with us from San Ysidro Health.
Yes, I'm here.
Thank you for patiently. I know it was going to be your first names, but we wanted to make sure that a couple of other people had the opportunity as well. So thank you for staying and thank you for sharing exciting updates about San Ysidro Health.
Yes, of course. Let's see. Are we going to be able to put up the presentation?
Yes, let's tap onto David.
Thank you.
Yes, he is coming through.
Wonderful. Good morning, everyone, and Happy New Year. I don't know how long after the new year we can start continue saying that, but
say it. We need the positive energy.
Good morning, everyone. My name is Alejandra Perez, and I'm the External Affairs and Media Coordinator with San Ysidro Health. So I wanted to give a quick overview about San Ysidro Health and a couple of exciting things that we have happened at our organization. So we'll go on to the next slide. So for us at San Ysidro Health, the mission of the organization is to improve the health and well-being of communities we serve with access for all. So this is very vital to our organization, and I think what we're going to be sharing will showcase how we continue to increase access for all of our communities throughout San Diego. Next slide, please. A little bit about the history of San Ysidro Health. Hopefully, most of you, if not all of you, are familiar with the services that we offer at San Ysidro Health. But originally, we were founded over 50 years ago in 1969 by our founding mothers, 7 women in search for medical services for their children. And our name comes from paying homage to the humble beginnings in the community. So the San Ysidro community was named in honor of San Ysidro Labrador, the patron saint of farmers, day laborers, and the working poor. So for us, San Ysidro spent his life as a hired hand and always shared what little he had, even his meals, with people in need. So these values of compassion and care continue to hold strong for San Ysidro Health's mission to improve the health and well-being of all in the communities we serve, especially the most vulnerable. Next slide. So a little bit about San Ysidro Health currently right now. We are a 501c3 federally qualified health center, and of course committed to providing high quality, compassionate, and accessible healthcare for the entire family. We are one of the leading safety net providers of critical primary care services and the second largest community health center in San Diego County. We provide through a vast, innovative, and integrated network of about 25 clinics. We continue to grow and expand, so this number is ever evolving and changing. 4 school-based clinics and 11 program sites and 3 medical mobile units throughout San Diego. We offer comprehensive medical, dental, behavioral health, and specialty care services. And we are a patient-centered medical home model of care where the patient is the focus of all of our care and services, not the support staff or providers. Also, we are the only health center network in San Diego to provide program for of all-inclusive care for the elderly PACE, which we'll talk about here momentarily. And for me, I am part of a growing network of staff, workforce of 2,000 plus, nearing 2,000 employees of highly trained, experienced, and caring medical professions and support staff at San Ysidro Health, and we're always hiring as well. So please make sure and take a look at our websites and see if there's any opportunities there that may pique your interest. Next slide. A little bit about our patient population and care. So this information has changed now that we're in 2021. So back in 2019, our patient profile, we were serving about 97,000 patients all throughout the county. With that, in 2020, we are now at over 107,000 patients that we are servicing all across the county. 94% of our patients lived at or below the 200% of the federal poverty level. 36% were children from ages 0 to 17, and 24% are seniors ages 55 and older. Again, as we talked about and mentioned earlier, some of our patient care consists of clinical treatments for our patients. That's medical, behavioral health, dental, and specialty, such as acupuncture and chiropractic. As far as some of our patient experiences, consists of clinical support for patients. We support with case management, outreach, nutrition, health education, family support programs, and research as well. Next slide, please. So a little bit about how we have pivoted, as everyone I'm sure here has pivoted with the beginning of the pandemic and COVID. So we have implemented telehealth, and telehealth has been allowing us an opportunity to really connect with communities all across the county and ensuring that all individuals have access to all the services that we offer at our organization. One of our big things within our organization at San Ysidro Health, we are really promoting COVID-19 testing with care. So understanding that we want our community members and patients to ensure that they're not only coming to us to get a COVID test, but there's going to be a follow-up with a provider as well to ensure that we are able to provide the resources and services and the medical services that the individual needs to ensure that they continue staying healthy throughout that process. So for any questions, folks are able to call our SY Health line, and that will allow them an opportunity to speak directly with one of our medical providers and to answer any questions that they might have regarding medical consultations as far as refilling any medications or behavioral health prescription refills and other services. We also do have a very comprehensive website at www.syhealth.org where individuals can get more information about COVID-19. So if you're living with someone currently right now who has tested positive for COVID-19, you may get some really great resources on there. If you are unsure of how to go about some of the resources, please go onto our website. It's really great. It's in English and Spanish, and you can get a lot of information about COVID-19 there. Next page, please. So this is one of our exciting things. So in the month of December, San Ysidro Health was staying very, very busy. In the month of December, we opened 2 new clinic sites. One of them that we are, in El Cajon, which is a comprehensive health clinic, and that is a 40,000 square foot building that we are really excited about. It does have one of our PACE centers, and then it offers a medical floor on the 2nd floor. And I'd be more than happy to share more information on the flyers later on that. But one of the ones that we really wanted to focus on is San Ysidro Health Urgent Care. So as we know right now, our ICUs in the region are at capacity. And so one way that we really want to support, we have partnered with Scripps Mercy Hospital in Chula Vista to really support these efforts, as far as ensuring that community members who are experiencing non-life-threatening illnesses, they're able to come to our San Ysidro Health Urgent Care Clinic. So you might be wondering at times, when does someone need to go to an urgent care clinic and versus a hospital? So of course, if anything, if someone's life is in danger, please call 911 or go to your nearest hospital. But if you have a fever, a sore throat, any minor cuts and burns, sprain strains, and simple fractures, dizziness, nausea, we can see you at our San Ysidro Health Urgent Care Clinic, which is located on 3rd and H in Chula Vista. So we are, of course, adhering to all CDC guidelines and ensuring that all our patients before they walk into the urgent care clinic are being screened to ensure that they don't have any symptoms for COVID-19. We do have reserved parking available on the 2nd floor, and we are located right off that parking structure immediately as soon as you walk into the building. And so for any individuals, we also want to emphasize that you do not have to have any medical insurance in order to be seen at our urgent care clinic. So we do accept Medi-Cal, Medicare, and uninsured are accepted. So regardless of ability to pay, please come visit us if you are experiencing any of the symptoms that we just talked about, or if you need to be seen by a doctor. Also, if you do have a primary care doctor and are unable to get a timely appointment scheduled with them and need to be seen by a doctor, please come visit us. All our physicians on site are emergency department doctors. So these are the same providers that you are going to be seeing at an emergency room at a hospital. So they are well trained and are able to ensure that you are being taken care of, and they are able to ensure that you are being treated well. So for any questions regarding any insurance, if you have insurance and you're worried about if our urgent care clinic is going to be able to accept it, please call our phone number. We do have an insurance line where we have an amazing staff that are able to verify that for you. Also, if you don't have insurance and you may qualify for insurance, you can still contact us at our insurance line, and they're going to be able to walk you through the process if you're eligible for insurance as well. So there's no need to worry about that. We have you all taken care of at San Ysidro Health. Next slide. So this is a little bit about our San Diego PACE program, which is the program of all-inclusive care for the elderly. And so the mission for San Diego PACE is to ensure seniors get the care they need to lead healthy, happy, and independent lives. So the San Diego PACE team is dedicated to supporting seniors and helping them age safely at home. And family caregivers trust us to provide that vital care at our centers across the county. Next slide, please. So who can join PACE? As far as in order to qualify for PACE, individuals have to be 55 years of age or older, living in the PACE covered zip code service area, certified by the state of California as needing a level of care equal to nursing home services, able to live safely and independently in the community with the help of PACE services. Next slide, please. Also, as far as, of course, our PACE program has had a pivot, of course, during COVID, and so we are still offering services to our elder population. So currently, right now, some of the services that are available are via telehealth, care home, wound care, caregivers, meal deliveries, grocery delivery, medications, activities delivered to the home, and virtually therapy and counseling. And we still have our dedicated staff going to the home very safely, again, adhering to CDC guidelines and with the patient's health in priority. And they are being able to provide these services to our community as needed. Next slide. So there's a couple of different ways on how to refer a patient, and they are listed there on the screen. Next slide. And also, one of the biggest things, as I mentioned, for us at San Ysidro Health, we want to ensure that we are creating and supporting to ensure that all of our communities have access to quality healthcare services. So as you can see, we continue to expand. We're starting with one standalone clinic in San Ysidro over 50 years ago. We have sites all across the county. So we have extended up to the North County region in Escondido. We have extended out to East County and Alpine and Campo. And of course, we are still located all throughout our South Bay community and region and Central San Diego area as well. So I think that's one of the misconceptions at times where folks don't know how big we are. So even if you have relatives that are living in East County, rural communities, North County, let them know our services are there and we're always welcome. We always welcome new patients, of course. Next slide. So that's all that I have for right now. Thank you. And the next slide, my name again is Alejandra Perez. And if you have any questions, I'd be more than happy to send you information regarding our urgent care clinic and the services that we offer. We're really wanting to ensure that our community right now knows that our services are here for them, and especially the urgent care clinic in Chula Vista, just so we don't have individuals that are going without care during this time of need. And then also to support our hospitals as they are tending to the critical needs of patients whose lives are in jeopardy.
Thank you, Alejandra. And I have here a question from the chat box. Is San Ysidro Health offering or planning to offer COVID-19 vaccine?
So as far as that, we're continuing to get information as it comes out from the county and the state. We will keep our community posted on that. So we are, as soon as we have a great team on staff who is working specifically on COVID-19, and they are getting the information out to us as quickly as possible. So at the moment, we are not offering the COVID vaccine to the community, but as soon as we're able to, or if we get the green light to do so, we'll keep you posted.
Yeah, I think the community is like phase 3 or so, and we're still on phase 1 for healthcare workers and other related ones, healthcare professionals. That includes the community health workers. So we are sharing the information about the COVID vaccines to our community health workers. And again, it's about the role, not necessarily the title, but the function that these invaluable health professionals contribute to the public health workforce. That was my plug. Thank you. Another item here for you, Alejandra. Could you please share slide info on how to refer a patient to San Diego PACE? David, maybe you can go back to that slide. But in the meantime, remember that all the slides, Yadira, that you see today are gonna be able, you can download them later this afternoon after David uploads to our link. And I have shared that link of the partners call in the chat box as well. We have it in front, so how to refer a patient? Can you do a brief synopsis, Alejandro?
Yeah, so there's a couple of different, so we have a team of dedicated PACE professionals at San Ysidro Health that can help you as far as any of the referrals, but you can contact that email svpace@syhealth.org. You can call them, or you can even fax them as well. My colleague, Jacqueline also Hernandez, she has put her contact information that you can reach out to her, and she can definitely guide you and direct you into the best way to refer a patient.
Yes, and again, the beauty of Teams is that all these chat boxes from any calls, they are housed in your Teams app, so it's available as well. So we're kind of cross-checking all our points and I's and T's to make sure that we disseminate the information and have it available later. Now we have concluded with the official presentations and some of the updates that some individuals have already shared. We have some more minutes to share updates and our program announcements from others. So you can take it away. You can raise your hand and we can call on you.
Brendaly, this is Alejandra. I just had one last plug.
Oh, yes, bring it on.
If any community organization or group is interested in flyers for our Chula Vista Urgent Care Clinic, I'd be more than happy to get those out to the community as needed. Just feel free to email me and we'll get them out. As mentioned, we really want to ensure that community knows about our urgent care clinic because we want to ensure that no one goes without any medical health treatment or services.
Thank you. Thank you. What a mission. What a great mission statement and making it a reality. Thank you again, Alejandra. We have the hand raised by Diego Avila Macias. Diego, what would you like to share?
Hi, everyone. Yeah, hi, Diego here with Jewish Family Service. I'm the Immigration Volunteer and Outreach Coordinator, and I just wanted to share that we have upcoming online citizenship classes starting January 18th and 19th. And we also have upcoming virtual naturalization workshops starting January 26th and January 27th. I'll be shortly sending out flyers after this, so you're in touch. But yeah, just stay tuned.
Thank you, Diego, for joining us today. We have another hand raised from Matthew from the CSA.
So, can you hear me?
Yes. Go ahead.
All right.
We have some background noise, so we would appreciate if you just mute your line. Thank you. Come on, Matthew, you're on. Oh, well, maybe while he addresses.
Oh, there it goes.
Oh, here we go.
The internet's a little slow here, but on the 26th of January at 2 p.m., we're doing a town hall with the NAACP. This is Matthew San Diego. We'll be joining the NAACP for a town hall on evictions, the moratoriums, as well as foreclosures, just to give some information to the community about resources available to really kind of address the change that's coming up here at the end of January when the moratorium participants end. We're certainly hoping that some new policies are implemented to extend that moratorium, but we can't be sure of that. So we want to make sure the community knows what resources are available. So I'm going to put the link in that, and then I'll also be available for any questions that you may have.
Thank you for that. I see that the town hall link is available already in the chat for people to copy and click on it now, so they have it on their Explorer. Thank you, Matthew, for sharing that. We have another, Latanya Reynolds. Yes, do you have your hand raised? And we also have Ingrid. Ingrid, are you available for your update?
Hi, yes, good morning. Thank you everybody for having me. I put it in the chat box already, but I want to let you know that we're having a working together virtual training hosted by Children, Youth and Family Liaison, NAMI San Diego. And this training, it's for people that would like to learn how to use their lived experience to support families under the Children, Youth care. And this training will have some CEU credit. So if you like this training, please feel free to reserve your space because it's limited, and we'll love to have you. It's starting on January 28th, and it's only a half-day training from 9 a.m. to 1 p.m. Thank you. I hope to see you all.
So Claudia, yeah, glad that you put the details in the chat box so people can immediately follow up with you. We have also Marco Lemus with your hand raised. Are you there?
Yes. Hi, everybody. Good morning. This is Marco again with Catholic Charities from the Immigrant Services Department here in San Diego. And I just wanted to let everybody know and remind everybody that we are assisting people apply to DACA once again for the first time. Once again, this is something that is very new for a while, since 2017 when the policy changed. Only people who had DACA already could renew every 2 years. But now the court has opened it again so people could apply for the very first time. So it's something that is great, and our offices are helping with that process. And we know it's a new process for a good number of people. So we're actually going to be having a virtual initial DACA orientation next Thursday. That's going to be January 21st. We're going to have an English session from 4 to 5 p.m. We're hopeful that a lot of the kids are out of school by that time. And then the Spanish one from 5 to 6 p.m. What I'm going to do is I'm going to include the registration link on the chat, but if you like any flyers, I didn't know how to attach them on here, but I'm happy to send those to you as well. So thank you, everybody.
Yeah, and if you send it to me and David in the next half an hour or so, they may be then included in the whole package of the slides of the call, the link to this call, for the recording, and any of those extra flyers we have been mentioning, and that will be a downloadable a file that you can download from our webpage at Chula Vista Community Collaborative, the link in the chat box that I put in earlier. Thank you. Let me see if I have covered. I still have some hands up, but they have spoken. Claudia Gonzalez, are you still there?
Hi, yes. Can you hear me well?
Yes.
Okay, perfect. This is Claudia from IB Clinic. I'm Imperial Beach Community Clinic and Nestor Health Center. So I just wanted to highlight our opiate treatment program. So we're consistently taking new patients. So any person that's interested in starting any type of addiction treatment, specifically opioids, we can typically see them within 1 day. So within 24 hours, we can get them into treatment, individuals with no insurance, or of course with Medi-Cal, Medicare, but even individuals with no insurance, we can get them into treatment and then help them get insurance. So that's at IB and Nestor Health Centers. I'll put my information in the chat box. So if you want to contact me, you can get a hold of me. That's it. Thank you.
Thank you so much. I see all those files being up and we would be able to download them and attach them in the downloadable file. Let me see, I have another comment from Marla Castañeda, unable to do the hand raise. Maybe we give an update. Okay, Marla, that's your chance now.
Hi, thank you. Can you hear me?
Yes.
Oh, okay, thanks. I was having trouble with the little hand. Yes, I'm Castañeda. I'm with UC San Diego Center for Better Beginnings, and we actually have a program called Mother to Baby California. It provides families up-to-date information about the potential risks of environmental exposures during pregnancy and while breastfeeding. So things like medications, recreational substances, work exposures, or even illness like COVID. So we're seeking a service, which is free and available in English and Spanish, to migrant, refugee, and immigrant women in California. So we'd like to connect with new partners and form some strong partnerships there. So I had put the link to the partnership page up earlier, so it's in the chat for you guys.
Excellent. Thank you. And I keep on seeing some chat comments, and there was a question from Yadira to Marco, but if I may, let me share that because it may be beneficial to others as well. So, Marco, do you have an interpreter bank to provide service during an immigration interview? And if so, how could that be accessed? Marco, are you still there?
Yeah, good question. So we don't have a formal interpreter bank here with us. Usually for the interviews, most of our clients have someone that can go with them. In the rare event that a client does not have someone that can go to a USCIS interview with the client, we usually reach out to our volunteer team to see if they are able to attend with the client. It's not often that is the case, and we have to check on a lot of things. Has to be approved by our attorney, because usually, depending on the case, it may require some prep. But so not formally, but if someone really needs it, we can help with that. But it would have to be mainly for the clients that we serve here, since the demand for that can be a little bit high sometimes.
Thank you for the clarification, Marco. And I think that I've covered all those hands up. Somebody else?
Hi, Nelly Gonzalez. I'm the Family Engagement Specialist with ECS Head Start. So right now, I just wanted to give you a quick update. We have our preschools or certified program and a program for prenatal women from National City all the way down to San Ysidro. And right now, we're not fully enrolled because we are doing it virtually. So we are kind of going along with the county school closures. So all of our services are virtual, but we are giving services to families and children, and we are accepting applications. They're online. I'm gonna put in the link here on the chat, so you can always go in there. Families can go in there and check out the application. They can apply online, and the children, when they are enrolled, they are getting lunches just like they would get them at school when they're in class. So the families do get that prepared lunch from our kitchen. And of course, we're always sharing resources with parents. So any resources you can always, several of you already emailed me, so thank you. So I just wanted to, I'll put my email there as well, because you want to forward flyers to me for families in our program. Thank you.
Thank you, Nelly. I'm glad that participating in the call, in the collaborative has worked for you and getting to those referrals. Okay, I think that we're getting close to the end of the call. Any final thoughts, final announcements? Well, just a reminder that our next call will be February the 9th from 9 a.m. If you are interested in speaking and in giving a more formal presentation up to 15 minutes, you're welcome to send me an email and we'll check out the dates available. The calendar is in, again, the slides that will be uploaded this afternoon. And I really wish you the best in 2021, a safe and healthy one, bringing the best of 2020 forward with a great spirit of value, demonstrating the value of what this partnership is. So a big hug virtually to all of you. Buenos días y until next time. Meeting is adjourned.
Thank you.